Good Wednesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to all the partner agencies and organizations who have supported our response over the past 6 months. There are too many to name individually, but numerous nonprofits, schools, businesses, government agencies, churches, and countless others have stepped up to help our community throughout this pandemic. They have provided assistance to those who've lost a job, food, housing, and many other crucial resources and services. Their selfless work is just one example of what makes this community such a great place to live. Today's example of a real-world way to implement the 5 core actions is visiting a park. Whether it's a greenway, local city or county park, state or national park, there are important steps that you can take to protect yourself and those around you. Fortunately, we don't have to travel very far to enjoy these parks, and spending time outdoors is a great way to just exercise and relax. When planning a trip to a park, avoid visiting the crowded parks or parks at crowded times or crowded campgrounds. Stay at least 6 feet away from people that you don't live with. Remember to take your mask so you can wear it if social distancing isn't possible. Avoid high-touch surfaces. Be sure to pack hand sanitizer. And if you're meeting friends or family you don't live with, don't share items with them like food serving utensils. And please, while being outside is thought to be lower risk, it doesn't replace the need to social distance and wear a mask when you're in close contact with folks. As a reminder, the Board of Health meets tonight via Zoom at 5 p.m. The public may watch the meeting live on Knox County's YouTube channel or the Knox County website. It also may be viewed later on community television. This week, today and Friday, we continue testing at the Jacob Building in Chowhowie Park from 9 a.m. to 3 p.m. And now we'll move on to the local situation. We have 68 new confirmed cases since yesterday's report, giving us 4,936 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 171 probable cases. 2,855 of our cases have recovered, giving us 2,207 active cases. 223 individuals have been hospitalized at some point in their illness, and 29 of those Knox County residents are currently hospitalized. And I'm saddened to report that we have 1 additional death today, bringing the total number of deaths to 45. Before we get to the benchmarks, we wanted to report that we have conducted a thorough data review for those who have passed away related to COVID-19. This has provided us opportunity to clean up demographic data such as age, gender, and race and ethnicity, in addition to confirming the date of death. There may be some slight changes in the data, which have been reflected on the website. Please note that the information received about COVID-related mortalities comes from hospitals, healthcare providers, hospitals, which are healthcare providers, the Regional Forensic Center, and the State Medical Examiner's Office, and sometimes all 3 of those. During the data cleaning process, we identified 2 individuals that were duplicates within the data. This is why the total on the website appears to be less than it was yesterday, even though we lost another resident today. As we have done in the past, anytime we discover a reporting error or change, we will address it publicly. We take integrity of our data very seriously. Now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see if things are getting better, staying the same, or are they getting worse? And if so, how much better or worse, and at what rate? We will now pull up the data, and as a reminder, all of this data that we are going to talk about is on our website, covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. We are marking this benchmark as yellow because we saw 1 3-day shift of yellow flags in the reporting period. That said, new cases appear to be stabilizing, which is encouraging. We hope the stability in new cases we're seeing translates into a downward trend, but there is a great deal of activity shifting in our environment in the next month, including schools and extracurricular activities, as well as the Labor Day holiday, which will have an impact. So we will continue to watch this local situation very closely. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test reporting turnaround time. For this benchmark, we are utilizing two bar graphs, one that shows a sample of the test conducted for Knox County residents and another for the average time between specimen collection and lab report data. For the data, we can see the trends continue to move in the right direction. The number of tests conducted continues to trend up, and the lab turnaround time in our community is decreasing. While we have seen a slight decline in testing volume community-wide, the overall trend does continue to move upward, as you can see by the trend line on the graph. As a reminder, the data we are reporting for this benchmark is from the previous week, so we can always make sure we are looking at a full week of data. This does continue to be encouraging, and is why we are representing this benchmark as green. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and contacts. Because of that, this benchmark continues to be represented as green. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with a pending test result in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. For this benchmark, the traffic light is yellow. We did experience a few days of flags, but overall hospitalizations have been trending downward. After speaking with our hospital partners, they stated this benchmark should be represented as yellow. The hospital systems continue to meet daily, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. In our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows reported deaths of Knox County residents by date of death. This benchmark is reported as red because we continue to see a statistically significant increase in deaths. While this benchmark is still generating flags in our monitoring systems and no deaths are acceptable, the rate appears to be stabilizing. As always, our thoughts and prayers continue to be with all of those who have lost someone to COVID-19. And with that, we'll open it up for questions.
Okay. Our first question is from Alan Sims here. Statewide numbers of reported daily cases have dropped recently in direct proportion to a reduction in testing. Is Knox County's drop in cases similarly a result of a reduction in testing? The charts on your site show about a 30% drop in testing over the last 4 weeks. About the same drop we've seen in cases. Shouldn't one or the other or both be represented in red?
Well, the way our data is designed to look at is comparing from day to day over a 14-week window, 14-day window, the previous 14 days, to look at changes and fluctuations in the data there. And they flag based on a standard deviation. And so at this point, based on what we are seeing, those have not been flagging. Now, as I said in the opening comments, we do see that there has been a little bit of a decrease in testing. There was a huge spike a few weeks ago when there was a lot of nursing home testing happening all at one time. But there has been a little bit of a downward trend, and we realize that, and we are keeping an eye on that. Regarding declines in testing and new cases, there are probably correlations there, and we will have to continue to look at that and see. And that's why we have a body of metrics that we look at. So things like hospitalizations, which really aren't as affected by how much testing is being done, how many new cases there are. If you're sick enough to end up in the hospital, you're going to be in the hospital either way. All of that plays a role into what we look at and report on. But our colors are based on very specific parameters that we've set forth. And we will continue to do that.
Okay, we have a question from the News Sentinel. It doesn't appear that the numbers are updating for them on the website, though they're updated on our end.
Yeah,
you shouldn't have updated twice. Vincent's asking if it updated twice because there's multiple versions and it's cache. I would try to clear that out and try again, and then let us know if that's not working. But as we look at it,
yeah, we pulled it up. Actually, I had a similar question, and we looked at it, and it was accurate when we pulled it up on our end.
Okay, and we have a question here from the Compass. Can the slowdown in new infections be attributed to the mask mandate?
I think that also is something that can come into play, and you can, look at the time frame that we had from the mask mandate until now, or more than 2 incubation periods. Which is what we would expect to start seeing change definitely. And it's encouraging. Correlation and causation isn't always the same thing, but something happened. And we are happy to see that the rate seems to be stabilizing and hopefully on a downward trend at this time. And we do believe that the increased mask wearing in public is having an impact.
All right, a question from Cole with WBIR. Our case count benchmark is yellow for the first time in a while. Is that good news? Should people relax their COVID prevention behaviors?
Absolutely not. People should continue. We cannot let off the gas. Having a few days of encouraging trends is good, and we need that. I think everybody needs to hear it, but that doesn't mean that the virus is gone. It's absolutely still here in the community, and we don't want things to spike back up. So we want everybody to continue to practice the 5 core actions everywhere to help prevent the spread of this infection.
All right, Megan with WVLT. Data released earlier this week showed a high percentage of clusters connected to community gatherings. What advice do you have for the Knox County community on how to prevent those numbers from increasing? And in addition, does the health department plan to present any data in support of the proposed limit on social gatherings at tonight's Board of Health meeting?
So the first part of your question, we've been saying for a long time that we see clusters related mostly to community social gatherings or having, when you're letting down your guard in your workplace with people you're around all the time. Basically, our belief is it's when you get to have a comfort level with the people that are around you, and we see a lot of that happening. So there's a few things. One, going back to what we say every day, following the 5 core actions all the time and doing it for everybody, whether they're your friend that you see at work every day or they're your next door neighbor. We need to be doing it all of the time. Also, do you really need to have that gathering? Consider that in this setting when we have disease spreading and we're trying to have an impact and decrease the spread of disease. Do you really need to have that gathering? And really consider that. And then how can you do it safely if you do need to have it, if you are going to have it? And that's where our real world tips are coming in. Setting up, if you're having people coming to your house, making sure you set up chairs more than 6 feet apart. So it's already built in when people are arriving, and asking people to wear masks if you can't social distance. All of those things we recommend that you continue to do.
And then her second part was, does the health department plan to present any data in support of the proposed limit on social gatherings?
We'll present the data that we always present every week to the Board of Health this evening.
All right, from Jeff with WATE. If there was a duplicate death, that would take us from 46 to 45. And then an additional death should put us back at 46, or did I misunderstand?
Yeah, I said there were 2 duplicates in our system, and so we removed those, and then we had 1 additional. So that's where the one net change of 1 is today.
All right, another question from Cole with WBIR. Are we seeing an impact from the mask mandate? I think you've already addressed that.
I think so. If you need me to, if you need me to expand, Cole, you can put something or add into your comment.
Okay, and Jeff again with WATE, if there were 2 duplicate deaths, how long might that have been on the books for?
I'd have to go and ask. I'm not real certain. I know we'll have to follow up with you on that one.
Okay. And then Cole with WBIR, how are things going with the new lab used for KCHD testing?
It's going very well. We're getting results typically back in 24, 48 hours. And they're managing the volume of testing that we do so far. So we're encouraged with what we're seeing.
And then there's two more parts to that. How was the transition process and how have turnaround times changed?
Transition process, it did take some work on our team. They have been amazingly flexible through all of this and moving locations and using different providers, which require different system processes and paperwork. And so there was a little bit of a learning curve with this new one, but it's always they're continuously trying to improve the quality of their work and our throughput and continue to do so. So overall, things continue to be going well. Our testing volume is growing every day with the new process. And then we are also, again, happy to report quicker turnaround times on lab results.
And Vincent with the News Sentinel is still having trouble with getting the website to show appropriately. So Vincent, let us follow up with your question with our IT department, and we can follow up with you to make sure that that's representing clearly for you on the website. Cole with WBR, if this pandemic were a marathon, what mile would you say we're on?
This is the longest marathon ever, is my first response to that. Again, I think that it's hard to tell. I think we need to see what happens in the next few weeks. Like we said in the opening statement, there are a lot of things going to be happening in our community that can impact the transmission that we're seeing just by nature of the activities and holidays and things of that nature. I hope that we've rounded mile 13 and we're going to continue to go down, but I think we really need to see what happens over the next few weeks.
All right, and Alan's also having challenges with the website. So Alan, we'll also follow up with you to make sure after this that everyone can access that information. Jeff from WATE, he'd like to know more about how those duplicates happened. Oops, it jumped up on me. Hang on just a second. I asked because a change in the death toll is sure to cause people to question the validity of any numbers.
Yes.
Is there a checking process?
So there is. I can say that one of those people were reported. Again, we get reports from 3 different sources, and sometimes we get the same report of an individual death from all 3 of those. And so one was honestly just a duplication in that 2 different people received the reports and put them into our information, and we missed it. And we're humans, and that happens. And then the other person was reported by 2 different sources, but had their names were different. And on the data review, we realized it was actually, in fact, the same person. And so we are looking at all of our checks and balances. And again, that was how we identified this one, was doing exactly what you're suggesting. And then being upfront when we noticed that we had an issue and making sure that we're making it public and cleaning up the information on our website and letting you guys know what happened.
All right, Jeff from WATE has another question. Hospitalizations increased from 26 to 29 on Wednesday, but total hospitalizations remained at 223. How is that possible?
We'll have to go back and look at that. Honestly, I can't do all of the math and look at all the detail in my head right now.
All right, and Cole with WBR, the WHO says the World Health Organization says people should skip routine dental cleanings right now. Do you agree with that guidance?
I didn't know who said that. I think that I would recommend talking with your dental provider and making sure that they're taking all the precautions that CDC and the American Dental Association, I believe is their name, are recommending, and doing everything they can to protect you. Dental health is important, and so we want to continue to make sure that we look after that. But we'll have to look into seeing if there's any recommendations coming down from CDC or any of our federal officials as well.
And Cole again with WBR, the governor said he would be distributing cleaning sanitation kits to classrooms across the state. Is KCHD part of that distribution?
No, that would go directly to the schools.
All right, and from Vincent from the News Sentinel, there appears to be numerous update errors in this day's reporting. Can you please double check the back end on your end and tell us when the website is current?
Yeah, we'll let you know. We apologize. Again, we had looked at it at one point and it seemed correct.
Yeah, Vincent, it looks like it's okay on our end, but again, we will follow up with our IT division to make sure that's pushing out appropriately and follow up with everyone and let you know the results of that. Are there any other questions for today? Vincent typed 1 second, so we'll do it in just a minute.
Okay.
Here we go. Vincent from the News Sentinel. The Board of Health was considering a limit on social gatherings to less than 25 people. How would that apply to schools?
The Board of Health recommendations don't apply to schools. That's a separate entity, and they follow Department of Education guidance.
And Cole, thank you for letting us know with WBR that you can see the data there at the station. So I'm glad it's working for you guys. And for the others who are having problems, I'm so sorry for that. We will follow up with you. That appears to be all the questions for today. So thank you for joining us, and we'll see you again on Friday.